There are 11 common mistakes that a lot of people make when they take supplements. Now, the first thing I want to mention is that I hear this a lot. We don't really need to take supplements because we can get all we need from our diet. And it's almost impossible to get vitamin D from food. So it's not actually very easy to get all of our nutrients, even if we ate a really good diet, not to mention certain foods that deplete us of nutrients, especially if you're doing a lot of refined carbs. Okay, number one, let's talk about timing, okay, during the day. When should you take your supplements? Personally, I like to take almost all of my supplements in the morning because I want all these cofactors to be available in the first part of the day when I need more energy. In fact, I switched my intermittent fasting pattern where I'm doing 2 meals. One is breakfast and then a late lunch, and then I don't have a dinner. That seems to work. And the reason I did that is because it gives me more energy during the day rather than doing fasting and then eating late at night when I don't need the energy before I go to bed. Now, as far as taking electrolytes right before bed, I don't really recommend it because electrolytes can push fluid out of your body. Now, as far as vitamin D goes, some people do better to take the vitamin D in the morning. Some people do better right before bed. It tends to help them sleep better. You can experiment with that. The other thing I want to mention about the timing is that you don't want to take any calcium supplements right before you eat because calcium neutralizes the stomach acid and it's going to inhibit your digestion. The next mistake I want to talk about is taking too many supplements at one time and trying to swallow them. I personally use myself as a human guinea pig for a long time. I've tried pretty much every single nutrient, vitamin, cleanse, alternative program you can imagine. And one time, long ago, I decided to do a gallbladder flush. In this gallbladder flush, you take beetroot supplements and olive oil. I took a hand of these beetroot supplements, put it in my mouth, and washed them down with 12 ounces of oil. Big mistake. I should have used some water and I should have taken a little bit at a time because those beet supplements got stuck in my esophagus. And it was like, I started getting chest pain. I thought I was going to die, like a heart attack. Oh my gosh, I'm going to die from taking supplements. So I just kind of laid in a ball and just pushed through it and somehow I survived, but I don't recommend it. That was very, very scary. Some people do better just taking their supplements with a meal. It seems to go down easier. Next mistake is this. If you're trying to solve a health problem, whatever it is, and you introduce a lot of different supplements at one time, you're not going to know what worked. So always introduce them one at a time, especially if you're trying to solve some health problem. The next mistake is thinking these vitamins are going to work if your diet sucks. I have a personal example of this. Yes, I was eating too many carbs at one time, but I wasn't consuming enough protein, especially for breakfast. And no matter how many vitamins I took, I was still tired. What I really needed was protein. Once I had protein, I'm like, oh my gosh, everything works now. But also, if you're eating too many carbs and things like that, you're going to get a lot of bloating. And I don't care how many vitamins you take for this or that, it's not going to create the effect. Next mistake is going for the cheapest vitamin possible, especially these one-a-days. If you read the label, which I have right here, I'm going to show you the first ingredient, calcium carbonate, which is the type of calcium in cement. So they're putting the cheapest vitamins you could possibly imagine, mostly made from petroleum and chemicals. A lot of the vitamin companies out there are owned by either chemical companies, big pharma, or some of the junk food brands. What I'm observing is they're not going for quality ingredients. They get the cheapest possible, especially when you get into antioxidants like beta carotene, for example, and you're taking it synthetically. There's some side effects. It shows that it increases your risk for cancer. Of course, they're not doing a comparison with that study on using antioxidants from actual food. No, it's the synthetic version. It's probably not the best way to do it. And the other thing you'll notice with the synthetics is the RDAs are the same, supplying 100%, 100%, 100%. In nature, you don't have that. And of course, you have fillers, you have colorings. And sometimes people think that there's no difference between vitamins. The synthetics are the same as natural. Well, I don't think so. Now, there are a couple vitamins that I think are fine to take synthetically. One is niacin, and then the other one is benfotiamine. But for some of the other vitamins, I would try to go more natural or get the vitamins in the natural complex that nature has provided. Now let's talk about the mistake sometimes people make with supplements and drug interactions. They're on a medication that's creating an effect, okay? And then they want to take a supplement that also creates the same effect. Doctors don't like that because then that might make the problem worse. So if you're taking a medication for high blood pressure and then you take a supplement to also help lower your high blood pressure and you end up with low blood pressure, then that might be an issue. So you need to check with your doctor so they can monitor that because, my thought is, why not introduce something natural? I'll give you an example. Let's say you're diabetic and you're taking metformin. Well, berberine also creates an effect very similar to metformin. Why not work with the doctor to just take less of the metformin because that could have some side effects? One thing I want to say about antibiotics is that you should always take a probiotic when you're taking an antibiotic so you can at least salvage the good bacteria. But here's the thing. If you're on medication, let's say, for example, for high blood pressure and you're taking magnesium and all of a sudden your blood pressure starts going too low, is that really a bad thing? Why not just get with the doctor to take less of that medication? Because magnesium is such an important natural remedy for everything related to the heart. One of the worst medications you can take for your liver, which is over the counter, is Tylenol. You might want to try milk thistle, an herbal supplement that can actually minimize the damage of your liver from some of these other medications. Next mistake a lot of people make with supplements is that there's certain vitamin or mineral interactions that people need to know about. For example, if you're taking high doses of vitamin D3 without magnesium, this could be a problem. You need magnesium for vitamin D to do its job. And without magnesium, vitamin D can't work. And also taking high levels of zinc over a long period of time, you can end up with a copper deficiency. So just realize that a lot of times these minerals go in pairs, like sodium and potassium. If you're consuming a lot of salt without potassium, that could be a problem. This is why I don't recommend taking one mineral for a long period of time, especially if you're doing high dosage. I would rather you take the one mineral in a blend of other minerals or trace minerals just to make sure that you don't create another problem. All right, next point I want to bring up is taking advice from someone that gives you an opinion about vitamins that's not really based on a good evaluation. There's not enough time in school to really fully understand biochemistry. All you have time to do is memorize things like this Krebs cycle, pass the test, and move on to the next subject. So there's a big difference between learning and understanding and memorizing. They're not the same thing. So you really want to get opinions from people that have a lot of experience in the area of what you're trying to get an opinion on. Like you wouldn't want to take marriage advice from someone that's never been married. And one last point about this, I think it's really important. A lot of the institutions and journals do not like to publish anything positive on vitamin D. Now, why would that be? Because it competes with the drug companies, and vitamin D is very inexpensive because you can get it from the sun. All right, next mistake I'm going to mention with supplements is not taking high enough doses. There's two reasons why people take supplements. One is to compensate from not having enough from their diet. The other reason is to create a therapeutic effect. And there's a lot of other reasons why high doses of certain vitamins are good. There's actually quite a few genetic weaknesses that make it more difficult to absorb certain nutrients. I recently had over 20 people get their DNA testing on vitamin D, and 100% of them had at least one genetic problem or weakness with either absorbing vitamin D or converting. So the solution is just to take a little bit more. Another common vitamin that I think people are not taking enough of is vitamin B1. I mean, the RDAs for vitamin B1 is ridiculous. Ridiculous. It's not going to do anything. Like they're 100 years old and they're just based on what you would need to prevent a deficiency. They're not based on correcting something or to create a therapeutic benefit. The other thing is if your stomach is not acid enough, it's too alkaline, you're not going to be able to absorb the minerals. You're not going to be able to break down B12 because you have to break down that protein that's connected to it, in which case you would need to take, betaine hydrochloride to acidify the stomach so you can absorb some of these nutrients. All right, the next point I want to talk about is if you are a vegan, right? You're not getting animal sources, so you really want to make sure you take additional nutrients on top of your diet because you're going to be deficient. You would need to take B12, you need D3, omega-3 fatty acids. If you don't want to get it from fish sources, you can get it from algae, iron, zinc, iodine, and calcium. Now let's get to the last one, dosing. And when I'm talking about dosing, I'm talking about how many times a week do you need vitamin D? This is so important simply because vitamin D is the most important vitamin because of what happens when you're deficient. The RDAs that they originally came up with, which is, 600 IUs, is sufficient. But there's another system that a lot of people do not know about. And this system is called the paracrine autocrine system. So this system is mainly dependent on either the sun converting the cholesterol in your skin to vitamin D, or the vitamin D in your food, or the vitamin D in your supplements. And the half-life for that is like 24 hours. So after 24 hours, it's pretty much gone. So if you're trying to support your immune system, you need to be taking vitamin D every single day or getting sun every single day, or it's very likely you're going to be deficient. The amount that I would recommend as a maintenance would be no less than 10,000 IUs. That's not unreasonable. It might sound like a lot. It's not. But the dangers of having a vitamin D deficiency are much greater than having any excess. And since we're ending off on this vitamin D topic, if you have not seen this interview with Professor Hollis, who is the pioneer in vitamin D research, you have to check it out. We go into this topic a lot more in depth, and I put that video up right here. Check it out.